Our state health assessment is for our agency a whole new creature. And I think we ought to all just remember that Kathy Wasserman and her team, they did a great job putting it together. So domain 3 is about informing and educating the public on health issues and public health functions. And this one is about health promotion policies, programs, and processes in health education. So their complement to us is the Washington DOH Guide for Health Promotion and Health Education Activities is an excellent document that could be used as a model for other state health departments. In addition, the use of the Health Equity Review Planning Tool within the DOH is innovative and effective, and they are planning an agency staff training in late summer of this year. So now we get to domain 4, which is about engaging the community to identify and address health problems. And 4.1 is cross-sector collaboration is routine and community health enhancing networks are fostered to promote the public's health. So they say to us, the DOH has made community mobilization and community engagement as a cornerstone of its public health improvement efforts. Clear guidance has been developed and adapted and adopted by the DOH to ensure the community concerns, ideas, and interventions are considered at every level of the agency. The DOH Community Engagement Guidance serves as a national model. And the Health Equity Work Group has started Community Engagement Guide Community of Practice meetings around the agency as a way to introduce this new guide. And they're going to engage early adopters and get them to help with best practices starting this summer. And then to launch the guide to the whole agency, it's being aligned with the evidence-based public health 6-step framework, which I will tell you more about in a minute. And they're going to roll that out through training and learning sessions in the summer and fall. So domain 8 is about workforce development. And this particular requirement or measure is about the work environment of the health department being supportive and fostering each staff person's contribution. So they say the DOH clearly makes concerted efforts to create a supportive work environment that recognizes diversity, respects life-work balance, provides opportunity for employee health and wellness, and encourages continuous learning and participation in state and national level activities. When they held the site visit with us, the site visitors were especially interested in our wellness at health. Sometimes I say that backwards. Do you ever say that backwards? Kim's here. She's going to talk with us about wellness at health. And also about our diversity and inclusion evaluation by the FACE Collaborative. They were very interested in those things. But clearly that's a stunning compliment to us, I think. Domain 9 is about continuous improvement. And this one is about a culture of continuous improvement being nurtured across the whole agency. And they say a specific complement to a quality improvement process that we wrote up at their request. This was actually a send us another one request. So they were like, yeah, those are fine. We'd like another one too, please. So we sent them the QI process used by the DOH in collaboration with the Liquor and Cannabis Board to develop and deploy warning signs targeting pregnant and lactating women about the perils of marijuana consumption is exemplary. And so I want to congratulate Kristen Haley and the Marijuana Prevention and Education Program for that excellent work. Domain 10 is about contributing to and applying the evidence base of public health. And this one is about the health department's programs and interventions being based on the best available evidence. So they say the evidence-based approach, this is the one that I was going to talk to you about. So they didn't call it a 6-step approach because it had a few more steps, but the steps have been streamlined into 6 steps now. And they say the evidence-based approach to improving the health and safety of the population, which includes steps that employees are expected to take to ensure that programmatic activities and policies are designed and revised using the best available evidence, is outstanding. The steps are detailed, are comprehensive in nature, and can serve as a model to other health departments. This was the brainchild of Kathy Lofi, and she's been, like I said, she's been streamlining it a bit, getting it ready to roll out. And it'll be piloted with a few programs this summer, and she has a student assisting her with that work. So now we're going to talk for like 3 slides about Domain 11, which is basically pretty much our back office, right? It's like administrative and management capacity. So Domain Measure 11.1 is about how the department organizes, leads, and manages its operations to reach organizational goals. You know, okay. They say that the narratives provided for information and financial management were excellent. And the process used and described for rebuilding and transforming government public health system in Washington can serve as a national model to other health departments considering modernizing their approach and role within the health department, the public health system. So this is rolling a bunch of stuff together. Allie Kelly and Amy Ferris in financial services, Shelby Egan and Jennifer McNamara in HCS did a great job of describing how we do our IT work and our financial work, and that is not a simple thing to do. The front of this report said, we could actually understand what you're talking about. You know, thank you so much for being clear. And so I really want to congratulate them for those write-ups. And then Marie Flake and Maria Corrigan in Foundational Public Health Services were being complimented for the groundbreaking work that they're doing in that arena. More Domain 11. This one is about the health department manages ethical issues. So they say, the array of policies and procedures guiding DOH staff in terms of ethics, whistleblower protection, outside activities, soliciting external funding, confidentiality, and research are detailed and clear and can serve as a model to other state health departments. The write-up was Kathy Luffy's write-up, so how detailed and clear it was is thanks to her. There's a lot of stuff in our policy arena. And the way the standards are written, it said, you know, we could give them one policy for all of that. And we were like, well, that'll never happen. So we had to roll it all together. And here's one that's a complement to a specific example. This is about the health department is culturally competent and accessible to populations. And they say, the Washington DOH provided an excellent example of a targeted awareness campaign to increase folic acid intake among Latino and Spanish-speaking populations. They used research, something, right? So they went to Domain 4. Measure 4.3 is about cross-sector collaboration is routine and community health enhancing networks are fostered to promote the public's health, right? And they say, while community engagement is a clear value for DOH, the site visit team recommends that additional efforts be made to reach out directly to communities for bottom-up feedback and health improvement efforts rather than relying on existing organizations and statewide partners to be the leads for community collaboration. And I think it's just interesting that right now, before we got this report, the State Health Improvement Planning work group is working really hard on how best to do this that they're suggesting. So it's something that we are already aware of and working really hard to do a little bit differently this time than we did, a lot differently this time than we did during the creation of the first State Health Improvement Plan that we had, that we called the SHIP anyway. So you might ask, what's next? And I'll just say that we're celebrating and letting people know about it. There'll be publicity out this week to everybody in the state of Washington about our reaccreditation. And then during June through the rest of the year, we'll be continuing to implement all those guides and policies and frameworks and things. And next year in March, we will have an annual report, which we'll have every year after that during the course of this 5 years. And that will include stories and information about more quality improvements that we're going to be doing. And also there'll be a few public health outcome measures reported to FAB as part of that. And we're waiting for the rest of it because, as usual, we're still guinea pigs and they haven't told us yet what our annual report's going to look like. So I'm ready for your questions. Oh my gosh. That was TMI. Tim.
How many different people did you coordinate with to accomplish that?
Right about 80.
Wow, great job.
And that doesn't count all the people who actually, the clumps of people who worked on things, like the group of health educators who put together that guidance we were talking about, or the group of assessment folks that put together the state health assessment. But there were just about 80 of us working from all of the, over the agency, working on the documentation. I'm very proud of all of us. I think we can all be proud of ourselves. Thanks a lot.